So another one of the hormones that you frequently prescribe to women is progesterone.
Correct.
So how does it work?
Sure.
How does the woman know if she's low in progesterone?
Progesterone is one of the key hormones that all women make, and no women should be without. Randy, there are 4 clinical scenarios where I use progesterone. Any menopausal woman gets progesterone, uterus or not, because we have progesterone receptors not only in our uterus, in our vagina, in our breasts, we have them in our brain or our blood vessels. Traditionally, women only got progesterone if they had a uterus because they just thought it protected against endometrial cancer. I see a lot of patients in my practice who come into me without a uterus, not on progesterone. So they get progesterone because progesterone is very calming. It protects against breast endometrial cancer. It works synergistically with estrogen to protect their heart, their bones, and their brain. It's very calming. It's involved in the sexual behavior response. Every woman gets progesterone. So that's number one. Women who are menopausal.
Every woman gets progesterone in your practice?
Every woman in my practice needs progesterone. Some women are making it naturally. They don't need it. But I'm going to give you the clinical scenarios where we use it.
Like 38, 40 years old?
38, 48. Yeah, so menopausal women
get
progesterone. Perimenopausal women, so women who have noticed they're skipping periods for the first time in their life, they're moody, they're gaining weight, they may have some hot flashes or night sweats because they're getting these wild swings in their hormone levels. How you balance them is to give them progesterone. So progesterone is so powerful in perimenopause, which Suzanne Summers talks about in her books.
Perimenopause is when you're just starting to get symptoms.
You're just starting to get symptoms. You notice you might skip a period, you might go a month, your bleeding may be a little bit more irregular. Those women do great with progesterone. They don't need antidepressants, which a lot of women get. They need progesterone. The third most common scenario of using progesterone in a woman who's in a reproductive age is for PMS. Women who have PMS, bad symptoms of PMS, and if you're suffering from PMS, I want you to hear me very clearly. There is a solution for you. It's not to take the birth control pill and wipe it out, which works for a lot of women. But the problem with birth control pills is birth control pills deplete you of B vitamins, they deplete you of coenzyme Q10, they increase your risk of clotting, they wipe out your libido, right, because they lower free testosterone levels. You give these women progesterone, because what will happen is the second half of their cycle, when they see these drops, if they don't get pregnant, they get these severe drops in their hormone levels. If you give them progesterone, they will feel great. And I've had women tell me for their PMS, it's a lifesaver. The last scenario we use progesterone is something called Pcos. It's Polycystic Ovarian Syndrome. I was talking about it before the show.
Okay.
It affects 10% of women of the reproductive age. It's the most common endocrine disorder in women of reproductive age. What happens to them is they don't ovulate. They can skip periods. They have a lot of acne. They have some hirsutism, which is coarse black hair in their chin, in their lip area, around their nipples. These women don't make progesterone. And if you look at the statistics for PCOS, they have a 4 times increased risk of breast cancer, their increased risk of endometrial cancer. They miscarry like crazy. They get pregnant and they have multiple miscarriages. And the solution for them, one of the solutions is to use progesterone. So progesterone is a very critical hormone.
So when you do that on some of your patients, the hair goes away?
Right, with
like their chin or
PCOS is multifactorial. We treat their insulin resistance. We treat their high androgen levels with medication. It's not from the progesterone. Progesterone is one component of treating PCOS, but it is a critical component. So menopausal women, everyone gets progesterone. If you're watching this and you don't have a uterus and you're not on progesterone, I will send you...
Are there women, though, that fit into that category?
The medical community still teaches if you have a uterus, you get progesterone. If you don't have a uterus, you don't get progesterone. Why? Because progesterone is so protective against endometrial cancer. Estrogen stimulates the uterus. Progesterone causes differentiation and it attenuates the effects of estrogen, so it's not as stimulatory, so it protects against endometrial cancer. So to traditional medical community, a lot of OBGYNs out there are still practicing, if you have a uterus, you get progesterone. If you don't have a uterus, you don't get progesterone. If you pick up a physiology textbook and you look at progesterone, it'll say, the first paragraph, we have progesterone receptors in our brain, in our blood vessels, in our heart, in our vagina,
so you
in
love
our breast tissue. Progesterone is very nice because it's super, super safe. You can give very high doses of progesterone and women just feel better.
Now this is a cream. Is that right?
I don't use progesterone creams. There are a lot of women who are on progesterone creams. We use it either sublingually or we give it to them orally in a capsule, because if you have trouble sleeping, which many women do in perimenopause and menopause, they can't go to sleep, they wake up frequently throughout the night because of hot flashes or night sweats, or they just have disrupted sleep patterns. You give them progesterone orally in a capsule because of how it's metabolized. It puts them to sleep and they get the best sleep of their life. So if you have sleeping issues, you get it orally in a capsule. You can use it during the day if you don't want it to sedate you via sublingual. The creams, you get very poor absorption and you have to use a lot. So again, when we're putting patients on hormones, I check their levels monthly until they're optimal. Why? Because it's important we get them in that nice, healthy range where they're balanced. We don't just give them a ton of progesterone. What we found in science is if you're using progesterone creams, which still a lot of patients are on progesterone creams, they come to me because they don't feel great. In the solution, I switch them to a capsule or sublingual troche or rapid dissolve tablet. It's like night and day.
So final message to a woman.
Final message is get your hormone levels tested. That's the first step. Because once we have the blood work in front of us, now it's apples to apples. We know what we're talking about. Because remember, health is multifactorial. There's stress, there's nutrition, there's exercise, there's sleep. There's all these other factors taking place. But if I have your hormone levels in front of me and your progesterone level is 0 or 0.1 or 0.2, which commonly it is when patients come in, then we know how to fix it. The solution's easy.
Okay, good. So they want to get started. They call your office or they go to the website.
Yeah, go to the website. Talk to my patient coordinator. She will walk you through step by step on how to become a patient. Within a week, we'll sit down. I'll review your medical history. We'll have your blood work in front of me. We'll sit down for 2 hours. And then within days, we'll have you balanced.
Okay, good. I want to thank you for coming on the show.
welcome.
Very interesting. You've been watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.